Good morning, everybody. Right. Now, Mr. Gill.
Good morning, my lord. The first witness today is Gillian Grant. She is one of three witnesses who will be giving evidence today from, I'll just call them the Sky Care Home Group.
Very good. Thank you very much indeed.
Her statement reference is SCI WT 0142 501.
Now, good morning, Ms. Grant. Please take a seat. Make yourself as comfortable as you can be. You'll be asked questions by Mr. Gale. So, Mr. Gale, when you're ready.
Thank you. My lord, the reference, in fact, should be 502 rather than 501.
Very good.
I think we probably know the statement. Good morning, Ms. Grant. Your full name, please.
It's Gillian Grant.
Yeah. And the inquiry is aware of your personal details and your contact address. And also, you can confirm that you've provided a statement to the inquiry, the reference I've just given, and that statement, together with the oral evidence that you'll give today, will be the evidence from you for the inquiry to consider.
Yes.
And you're agreeable that your evidence is recorded for that purpose?
Yes.
Thank you. Now, you're here to talk about your grandmother.
That's correct.
And I think you refer to her as your gran.
Yes, or grandma, yeah.
That probably makes things a little easier because I think you're aware there is a restriction order in place so that you cannot name your grandmother in terms, or indeed any other members of the family, or indeed any other persons, so people who may have been carers for your grandmother, but you can name the location where your grandmother was in care. So.
Okay.
Now, we know that your grandmother sadly passed away on the 4th of November 2020, and she was 91 when
That's
she died.
correct, yeah.
And she was in a care home. We'll come to the care home in a minute. But she was in a care home when she died, and we are obviously aware of some details about that care home, and I'll ask you a little about that. But first of all, can I ask you a little background about your grandmother? You describe her in paragraph 4 as, quote, a very mischievous little old lady.
Yes.
You say she was great fun, she was talkative, and before going into care, she lived just around the corner from you, and you've always had a very close relationship. Is that
Yes,
right?
we did, yes.
Yeah. And you say that you loved her and you miss her very much.
I do, yes.
Prior to the pandemic, she lived in sheltered accommodation where she'd been for between 18 and 20 years.
Yes.
And I think she was very settled there.
She was very happy there. Yeah.
And again, it was in vicinity of you, and you could pop in and see her regularly.
I could, yeah.
And as you say, she was, and you say in paragraph 8, she was particularly happy living there. There was, however, a deterioration in her condition, and she struggled to appreciate the nature of the pandemic when it struck in 2020.
Yes.
Could you just explain the difficulties that she had in relation to that?
Yes. She'd suffered from quite a lot of pain in her legs and her back, and she had some falls. But she also had a mild bit of dementia, which meant she was forgetting some things like taking her pills and just some general things. She had difficulty with dates and times and what day of the week it was. But with regards to the pandemic, she just found it very hard to understand what was going on. With regards to looking at the television, she didn't really understand the information that was coming across from the media. She was also very hard of hearing, so it was difficult for her to understand the television at the best of times.
And did you try to explain some of these things to her?
We did. As a family, we tried to explain it best we could. I tried to explain it by writing letters to her. Her eyesight wasn't great either, so I would type letters in big, bold writing to try to explain things as best I could. But I think a mixture of the mild dementia, the deafness, and her eyesight, she often maybe thought that the world was still revolving outside, and she was very isolated inside and thought that what was happening to her wasn't happening to everybody else.
Now, you've very helpfully in your statement set out the reasons why the decision was taken to move your gran into a care home. And I think amongst those reasons, not least, was the fact that she was going a bit deaf.
Yeah.
And that she'd had a number of falls, and that, as you've said, there were indications of dementia.
Yes.
Yeah. And at paragraph 18 of your statement, I should say your statement will appear on the screen in front of you. But at paragraph 18, you indicate that social services became involved and that they said that they felt that your gran should be in a more, as you put it, a more regimented type setting.
Yes, that's correct. A paramedic actually wrote a report to the GP, and this was after they'd been called, I think, on 2 occasions, and they felt that she wasn't capable of being on her own anymore, and social services suggested that she went into a care home. And the doctor agreed with this, and my gran was quite old-fashioned in that sense, that if a doctor suggested that she did something, she pretty much thought that was the right thing to do.
Yeah, yeah. So it was doctor's orders, was it?
Pretty much, yeah.
Yeah. And I think your parents also discussed it with your gran.
Yes.
And your gran was able to appreciate it, and she agreed to the move taking place.
Yes.
Yeah. Now, the care home that she went to, was it one that your gran had been able to see before she went in there?
No, unfortunately, due to the pandemic, there was no access to anybody other than residents during the time. So my gran, nor myself or any other family members were able to view the care home prior to her going into the care home.
One thing I think I've probably slightly forgotten to ask you, I think you and your father had a power of attorney in relation to your gran.
That's correct, yes.
But also at and around this time, and I don't wish to get any further details about it, but I think you were ill.
I was, yes.
And I think you say that had you been healthy, you would have at least contemplated trying to take your gran into your own home to look after her.
Yeah.
But you yourself, I don't think, were particularly happy about the situation of your gran going into a care home.
I think it was a concern more about the fact that it was COVID and there was a pandemic, and it felt that maybe it wasn't the right time to be going into a care home. But I understood that my parents weren't fit enough to take my grandmother in, and my son was a key worker at the time, so it would have been quite dangerous for her to come to live with me, and also I was really unwell at the time as well, so there was a lot of decisions surrounding the factor of why she went into the care home. Was one of the, I suppose, possible positives
about your gran moving into the care home, that she would have had a little bit more company.
Yes, that was certainly discussed with her, and that was one of the reasons that she seemed quite keen to go. She did feel very isolated at that point. We, as a family, had to, in order to protect her, had been staying away from her quite a bit because we were very, very concerned about any risk of giving her the virus at all. So she had very little interaction prior to going into the home with anybody, really, by way of protecting her. So I think she felt that going into the care home would be a way of being able to interact with people.
I think she moved into the care home in between August and September 2020. Yes. So we were some months into the pandemic at that time.
That's correct.
Prior to that, how were you able to see your gran? Were you able to go to her home? And if so, what precautions did you take when you went to see her?
I did go to see her a couple of times just before she went into the home. When we were obviously under lockdown, I didn't go to see her. And then when we came out of lockdown, I went to see her, and I was very, very cautious. I would usually I always took a COVID test before I went to see her. I always wore a mask when I was visiting her, which was very difficult because of her hearing issues. She often lip read, so that posed a lot of problems. But I was just so terrified that I would give her the virus that I did everything in my power to make sure that didn't happen.
Yeah. Now, at paragraphs 25 and 27 of your statement, you indicate that your gran was a bit upset about the move and somewhat scared, I think is how you put it.
Yes.
But she wanted to go ahead with it, partially because her doctor had recommended it. Could you explain perhaps how she manifested her upset and scaredness about it?
I think this was probably the day before she went to go. I'd gone round to help her pack her things. She'd asked me to come round. And I think naturally the fear was starting to set in of the unknown. Under normal circumstances, most people would have been able to go to see where they were going to live. And that would have probably settled her a lot more. She would have known where she was going, what it was like, what the people were like. But because she knew none of that, she was leaving her home of 20 years to go and live somewhere completely unknown. Like I said, she did have mild dementia, so that complicated things. She couldn't take most of her belongings. She could only take one suitcase. And she wasn't going to be able to see any of her family members at all for a period of 10 days because she had to go into isolation. And she knew she would have to stay in this one room that was not known to her or familiar to her for those 10 days. So she was scared.
Yeah. And you yourself took her, as I understand it, to the care home on that day?
I did, yes.
Yeah. And effectively, you had to drop her off there, and leave her there.
Yeah.
Yeah. Do you know what the restrictions were, or the guidance at that time about entering the care home?
I don't know what the official restrictions were, but the care home's restrictions were that nobody was allowed to come in apart from residents and staff.
Yeah. And potentially a new resident was allowed to come in, but
she had to go straight to her room and isolate.
Yeah. And she was required to isolate for, I'm sorry, what period?
10 days.
10 days.
Yeah.
Now, you mentioned earlier that you wrote your gran letters.
Yes.
That's probably a novel concept for us now, but we should encourage. You wrote to her and told her about the restrictions and about the isolation, I think, is that right?
I did. I wrote to her and told her about a lot of things about the care home, about the restrictions, as many nice things as I could to try and put her at ease, and anything I could tell her about the care home and how things would work, just so that she fully understood what was happening.
Right. And obviously, while she was in isolation, you were not able to visit her.
No, I could visit her through the window, at the window, because we were lucky enough that she was on the ground floor. Yeah. But other than that, no.
Did you visit her when she was in isolation and see her through the window? Did you be able to do that?
Yes.
Yes. Yeah. Yeah. There was, I think, at that time, some suggestion of the possibility of garden visits.
That's correct, yes.
How was that communicated to you?
We were told that before she went into the home, that she would be allowed to have one person nominated for garden visits. And she was to decide who that would be. So she asked me to be her named person for garden visits. And they said that once she was out of isolation, they would arrange for garden visits. We weren't told, I don't recall being told exactly how often we would get garden visits. But as I say, they said that when she came out of isolation, we would be allowed to have arranged garden visits with her.
Yeah. Now, you tell us about the home that your gran went to at paragraphs 30 and following. It was Mavis Bank Care Home, I think is the name of the home that she went to. And we can read that section, and we will hear a little more about your views on the care home as we proceed. You were able to have some garden visits, and you refer to these at paragraphs 43 and 44 of your statement. And the one thing we've heard already, Ms. Grant, is a lot about garden visits and the downside of garden visits, the weather in particular, and distancing that one had to keep from a loved one. So this is something we are conscious of. But you say at paragraph 43, in relation to garden visits, that it felt as if we were on a prison visit, and it felt very inhumane, as though you weren't trusted to touch your loved one. I think you were under supervision.
Yes. When
you were there. But one of the things you observed was in that period of time that you thought that your gran had lost weight.
Yes, I actually bought her a jacket, a coat, because she had lost weight. The coat never reached her. That's
This was the disappearing coat that you talk about in your statement.
That's correct.
It didn't get to her.
It didn't get her. It was a brand new coat that still had the price tag on her, just in case she didn't like it. But when I handed it into the care home, it never got to her. Yeah. And there was no explanation for that. So she had to just wear one that she already had, so it was far too big for her. It drowned her. But yes, because it was so cold, she just had to wear it. The garden visits were very inhumane, is the only way I can describe it. The first thing she wanted to do, because she didn't understand, was come towards me and hug me, and yes. I had to hold my hand out and stop her, which felt awful. We were watched over the entire time, as if we weren't trusted.
Was your gran able to understand why you were having to put your hands up and ask her to keep distance?
I don't think so, not really.
No. And one of the points you make in paragraph 43, and again it's a point we've heard from other witnesses, is that you felt as if you weren't being trusted. and you say, which in itself is crazy, is the last thing you would want to do is to put somebody at risk.
Yeah. It felt as if we were being watched over to make sure that I didn't take my mask off or hug her or go too close to her. And I thought, for a start, I tested myself before I went for the visit. And the last thing that I would want to do was put my grandmother in danger. So the fact that this staff member had to watch over us the whole time that I was there just seemed like utter madness and a waste of resources that could have been spent elsewhere. This person could have been going helping somebody that needed help while I was sitting with my grandmother looking after her effectively. They didn't have to be there watching me.
Yeah. Just one point. In fact, in paragraph 41, can I just ask you about, you mentioned there that I think your gran had said to you that she'd been taken for a shower. And you describe you said, oh, well, that's good. And then your gran explained what the shower comprised. Can you just tell us what that was, please?
Yeah, I said to her, oh, that's good, you had a shower. And she said, no, they took me and they threw a big bucket of water over me. And people with mild dementia, she had a habit of sometimes telling little tales and stories. Mm-hmm. So at first I thought maybe that was something like that, but it stuck in my mind because I thought it was a very odd thing for her to say. I've since spoken to quite a lot of people with relatives in the home and people that have worked in the home, and I really do think that might have been the case, that did happen.
Yeah. Thank you. Right. You have also expressed concern about a lack of care in the home. And one instance, depending on, I suppose, whether your gran was telling tales or whether she was being accurate about the shower, but I think also the coat, which you delivered for her, and it never apparently reached her.
Yes.
And also, you tell us about a situation when she was having a meal. Can you just tell us about that, please?
Yes. I'd gone to visit. I'd been passing one night. Usually I had a whiteboard that I took with me that I could write messages on when I stood at the windows, because she obviously couldn't hear me. So if there was anything I needed to say to her that was important, I would write it on the whiteboard. But I just happened to be passing that night. I hadn't planned to drop by, and I decided to go past anyway and go to the window. And they brought her dinner to her while I was there. And it was a plate of mince and chips, which I thought was an odd dinner to begin with, but she started to eat it, and she had a great appetite, my gran. She was a tiny little woman, but she had a great appetite. And she started to eat this meal, and I looked down at it, and the mince was pink. It was raw. And between her deafness and the window, I didn't want to panic her. And I knew that, and I didn't have the whiteboard, so I didn't know how to communicate to her not to eat it. And if I'd just started hammering at the window and flapping my arms, she would have panicked. She wouldn't have understood what I was saying. And she was still eating away at it. We had issues with the care home if we went to the door, that they didn't answer it. There was a day that my mum had gone, and it had taken over 40 minutes for them to answer the door. By the time I would have gone to the door to tell them that there was an issue with my grandmother's meal, she would have eaten the whole thing. So I felt helpless, and I just had to stand there and let her continue to eat it.
Did you make any representations about that to anybody in the care home?
I went in and spoke to them afterwards, and they said that they would deal with it.
Okay. Yeah. I suppose on the basis that your grandmother had eaten it.
Yes.
That was a little bit late, perhaps.
Exactly.
Okay. Just a little bit about PPE in in the home. You talk about this in paragraph 48 of your statement, and you make certain comments about the PPE that was being used. Perhaps you could just explain what if you had a concern about the PPE that was being used by the carers within the care home.
It was very inconsistent. You know, sometimes you would see staff with aprons on, sometimes you'd see them with gloves on. I don't ever recall seeing anybody using hand sanitizer. But what did really upset me was the use of masks. They would come into my grandmother's rooms either with their masks on or round their chins. And quite often they would come up to her and they would speak to her, and if they had their mask on and she couldn't hear them, they would take them down to speak to her because they were frustrated about her not being able to hear. And they would maybe only be this far away from her face, and then they would talk to her. And I remember being on the outside of the window thinking, well, they could have been at home kissing their children that have been at school, or their husband that's been at work, or they've been at the supermarket. They could have been anywhere, and they could be carrying this virus, and yet I'm on the other side of this window and I'm not allowed in there. Yeah. And it didn't seem right to me, and they were putting my grandmother in danger.
Yeah. You yourself, as paragraph 50, say that when you went to visit her, you always did self-test.
That's correct, yeah.
Do you know what testing, if any, was done of your gran?
As far as I am aware, the only time she was ever tested was when she was tested and was tested positive.
Mm-hmm. We'll come to that in a moment. And you do mention that you were aware, and this is paragraph 51, that you were aware of an outbreak of COVID within the home, and that was an outbreak that led to a number of deaths within the home.
That's correct.
Yeah. Yeah. Again, a feeling that we've heard other witnesses talk about is one you refer to in paragraph 52, which is guilt. And I think you not only say guilt, but you also say anger.
Yes.
Can you just explain those feelings, if you can?
Yeah, I think I was very angry about not being able to go in and see her and not be with her. And there was a lot of anger towards the staff and the staff's attitude, the way they behaved. I think, actually, the next paragraph.
Yes, well, we get the Indian restaurant visit,
yes.
I think, in the next paragraph. Tell us about that.
Yeah, I was at the window with my son and his girlfriend one night, and there's an Indian restaurant just pretty much across the road from the care home. And I think it was the staff changeover time, and all the staff came out of the building. There was about 10 or 12 staff members, and they all left and went straight over to the Indian restaurant. And I remember thinking to myself, well, hang on a minute, so they're all away to socialise and have a lovely time in this Indian restaurant. It felt like an unnecessary risk. They would all be returning the next day and putting everybody in the care home at risk. Mm-hmm. And all these poor people that were in the care home had been locked up there for months on end with no outside, other than the garden visits, interaction. And my gran hadn't left there since she'd got in, and all she wanted to do was go for a bit of shopping or a cup of coffee, and she wasn't allowed to. Yet these staff members were allowed to do whatever they wanted, and they had no regard for the safety of the people they were caring for.
May I be pedantic at this point?
Yes.
It's genuinely just pedantry on my part. We know that this must have been between August and September and November of 2020 for obvious reasons. I will be honest, I cannot remember exactly what the state of guidance was at that time. But my recollection, which may be incorrect, is that when, and it's purely based on personal experience, is that when the restrictions were eased and you were allowed to go to a restaurant, there was a limitation on the number of people that could go. I think it was 4, although I may be wrong in relation to that. And the reason I ask this is because you say in the paragraph I'm just reading that 10 or 12 of them headed to an Indian restaurant, and I think you inferred or you said that you saw them going into the Indian restaurant. Now, of course, we don't know what they did when they got in and what the table seating arrangements were. But is your recollection the same as mine, that at that time the limitation on going as a group or whatever it was 4 people?
Yes, and I believe I remember us talking about that at the time.
Yeah. All right, small point, but I wanted to be clear about that. Thank you.
Thank you, my Lord. We now move on to an area which is headed, we'll just call it Do Not Resuscitate. And I understand this is a particular concern for you and a point that you want to get across to the inquiry. We'll look at it in a little detail, but so that we know the timeline for this, it was a few days before your gran died that you got a call to say that a member of the staff had tested positive
That's
for
correct.
COVID. Yeah. Was that the first time you got that information?
Yes.
Yeah. And I think you say that member of staff worked a lot on the ground floor, and that your gran was on the ground floor.
Yes, and apparently the staff member had worked quite a lot with my gran.
Okay. And then the following day, the care home contacted you to say that your gran had tested positive, but that she was fine and that they would keep you updated.
That's correct, yeah.
Now, perhaps one point leading on to another. You do say, as we progress through the next few paragraphs of your statement, about your understanding that the care home had given your gran a mild sedative.
Yes, this was a good few days later.
Right.
Basically, they advised that she was still relatively well, but that her oxygen levels were lowering, but that she was on oxygen through a nasal cannula, and that every time she took it out, which she had to do when she was going to the toilet because it was an oxygen canister, that the oxygen levels were naturally dropping. And I think the main reason for this was because she was forgetting to put it back in when she came back from the toilet. So rather than any other way of dealing with that situation, their way of dealing with it was to administer a mild, what they said was a mild sedative, to stop her, I think, getting up so much, more than anything else.
Yeah, and you very helpfully summarised that, but it's in effectively paragraphs 57 through to 59 of your statement. Now, just in relation to this, in paragraph 59, you say that your mum agreed to that, which is the administration of the mild sedative.
Yeah.
And what was your reaction to being made aware of that?
At the time, I was okay with it because it had already been done. There was no point in making any, changing anything at that point. And we were advised it was a mild sedative, and so we thought maybe it would make her more comfortable. In hindsight, I realised that there is more things that could have been done. She could have been given an oxygen mask. Somebody could have helped her, make sure she went to the toilet and replaced it. And also now that I know what she was given, it makes no sense to me why she was administered it.
So I think you go on to say that your understanding of what she was given, it wasn't a mild sedative.
That's correct.
What about your mother's role in that?
Well, my mother was not power of attorney, so she shouldn't have, the care home should not have called her to ask her what medication they could have provided to my grandmother. It's not my mum's fault at all, but the care home, I felt that they actually possibly exploited that situation a little bit, that they phoned my mum out the blue and put her in the spot a little bit by asking her that.
Right. Okay. This brings us on to Do Not Resuscitate. What was your understanding when your gran was in the care home about any Do Not Resuscitate notices that may have existed in relation to her?
My understanding was that there were no Do Not Resuscitate order against my grandmother. I was asked if I would put one in place, and I categorically said no. The reason for that was that whilst my grandmother still had mild dementia, she still had capacity to make those kind of decisions. She would forget things. She maybe sometimes mixed up certain things, but she would still have full understanding of something like that. So I didn't believe it was my place to make that kind of decision for her, unless she was not conscious or anything like that, in which case then that might have been a decision I would have made. But
or presumably if she had been able to discuss it with you.
That's correct, yes.
Yeah. And you subsequently ascertained that there was a Do Not Resuscitate notice in relation to your gran.
That's correct.
Can you just explain how you came by that information?
We had heard that there was a possibility that there was a Do Not Resuscitate order. After my grandmother had died, we'd heard from the solicitors that there was talk that there was a Do Not Resuscitate order in my gran's file, but nobody had ever seen it, so we didn't know the full facts of it. But when I actually sat with the inquiry team to give this statement, my solicitor produced the Do Not Resuscitate order, and it had my name on it, and it was dated on the 2nd of November. And sorry? I've got a copy of it, but it's kind of block capital letters with my name.
So in other words, not your normal signature?
Not my signature at all.
Was the possibility of a DNR notice ever discussed with you by the care home?
Yes, it was.
Yeah. And could the care home have understood from the discussion that they had with you that you might be authorising a DNR notice for your grandmother? Absolutely
not. My exact words to them were categorically, I do not want to put a Do Not Resuscitate order in place.
You tell us in paragraph 65, which is a lengthy paragraph about this, that the DNR is incomplete.
Yes.
How is it incomplete beyond the point that you've just clarified with His Lordship about your signature?
There's a section in it that asks if the patient is aware of the Do Not Resuscitate order being in place, and there's a box to tick yes or no, and neither box is ticked.
Right. And I think you also say that it wasn't dated.
No, it is dated. Sorry, that part's not dated yet, so
right.
That part should be ticked yes or no, and it should be dated, okay. and it isn't.
Right. Have you any idea how this DNR notice came about?
Absolutely no idea whatsoever.
Did you make any representations when you became aware of it obviously ex post facto of your grandmother's death.
It wasn't that long ago that I actually got
Right.
the documents, so no, not yet.
Okay. All right. I think you've said that you'd be happy if the inquiry were provided with a copy of it, and
Yes.
I think we'd be grateful to see that. So.
Yeah.
Thank you. Sadly, we know that your gran died on the 4th of November, and I know from what you say at paragraph 115, and it's not necessary for you to look at this, that you have an issue about the time of her death.
I do, yes.
By about 10 minutes, I think. But
Well, more than
well,
that.
you think it may be very different.
Yes.
But ostensibly about 10 minutes.
Mm.
Yeah. Now, we know, and I don't want to go through this in detail because I'm sure it's very upsetting for you, but you were called by the care home on the day of your grandmother's passing, but she'd already passed away.
They didn't say that to me on the phone, no. They said that she was deteriorating, and as per my previous instructions that had been in place all through the time she had COVID, I said, have you called an ambulance? And they said no. And I said, well, can you call an ambulance? And they said, she doesn't want that. And I said, well, I want that. Can you please do that? And they said, I think it's too late for that. And I said, well, what do you mean? Because the last interactions I'd had with them, they told me she was absolutely fine. And the last time I'd seen her, she was walking about, eating and drinking, absolutely fine. And that was about 12 hours previous.
Right.
So I couldn't understand why I was getting this call.
Right.
And they said, no, I think it's too late to call an ambulance. I got the impression I was getting nowhere with this nurse on the phone, so I said, can I come in to see her? And the response I got was, if you want, which I thought was quite odd response to have. So I went straight to the care home with my mother and my uncle.
And when you got there?
When I got there, we walked in the door and we were told that my grandmother had passed away 10 minutes prior to us arriving.
Right. One of the points you make in your statement is that there was, as you put it, a young girl who had been sitting with your grandmother all night.
She claimed she had been sitting with my grandmother all night, yes.
This is paragraph 69. You put it as that she claimed that that had been the case. Do you have reason to disbelieve that?
There's a few reasons that I disbelieve that. One of which, what I don't understand is if she'd been sitting with my grandmother all night, then the only reason that would happen would be as if she thought my grandmother was dying. That's the only reason a member of staff would be allocated to sit with somebody all night. And if that was the case, then why would they not have contacted us as a family? The only reason to be allowed entry to the care home at that point would be if somebody was at end of life. And that would be the only reason she would have been sitting with my grandmother all night. And we weren't contacted at all. The other reason was that there was only 3 members of staff on that night, and she was one of them. And I could see how busy the care home was at that point. And if she had been sitting with my grandmother all night, then I don't know how the other 2 staff members were possibly coping with all the other residents.
Okay. You also noticed when you saw your gran that she was wearing a jumper in bed.
That's correct.
Slightly unusual, presumably.
Yes. So this was, by this point, 20 to 5 in the morning, and she was wearing a woolen jumper.
And you feel that she may have been dead for longer than you were told?
Yes, we all felt that. Her mouth and her eyes were wide open. And one of the first things I tried to do was to close them. She didn't look at peace. And I couldn't. My mum, who's a retired nurse, also tried to do the same, and she couldn't. She was very cold to the touch. And considering they told us that she had only passed away 20 minutes ago by that point, that didn't seem right to me. The colour of her skin wasn't right either. There was various factors that led all three of us to believe that she'd been dead for considerable periods of time.
Now, you did eventually see some of your grand's medical notes.
Yes.
And I think one of the things that you noted from that was that there was a marked or noted deterioration in her condition at 11 p.m. the previous evening.
Yes.
And then again at midnight, there was a deterioration. And you posed the question as to why there wasn't a call to you at that time.
That's correct. For two reasons. Because in the first instance, I would have requested that she be sent to hospital if I'd known that there was a deterioration, and I would have been with her.
Now, just on the question of sedation, you have ascertained that the sedative that she was given is one called midazolam.
That's correct.
And we've heard about midazolam from other witnesses, and I think it is associated with end-of-life care.
She was also given 2 other drugs that were part of an end-of-life protocol.
And what's your reaction to learning that?
I'm very angry and very upset about it. From the medical notes that I've read, the GP had called on the 3rd, the day before she died, to check on her condition, and the care home had actually said that she had improved slightly from the day before and that her observations had got better. The GP had actually said that whilst they had got better, they were still still a bit poor, and would she perhaps benefit from going to hospital. The care home had stated that us as a family didn't want her to go to hospital, and that my grandmother didn't want to go to hospital. But none of this is anything that we had said. We never once said that we didn't want to go to hospital. Sorry, I'd always said the exact opposite. And if my grandmother had said that she didn't want to go to hospital, then I, as power of attorney, could have overruled that. Also, it said at this point that there was a DNR in place in the medical notes, which again, I've only had sight of recently, so I wouldn't have known that at the time. So the care home staff said no, the family wanted to remain at the care home, and the doctor said, fair enough, we'll leave things as they are. We will give you these drugs, and it was the midazolam and the 2 other drugs, which are part of an end-of-life protocol, just in case, was the terminology used in the medical notes. But there wasn't specific instructions to administer them at that point. So I don't know at what point the care home chose to administer those drugs, but it must have been at some point between the afternoon of the 3rd and the early hours of the 4th.
Yeah. And just to be clear, you weren't consulted in any way about that?
No.
Just going to paragraph 82, if I may, of your statement. This is after your grand's death, and you recall sitting in her room and watching staff go out from her room to other rooms, as you put it, without changing their PPE. And
Yeah.
you say that struck the fear of God into you.
It did.
Explain why.
I was sitting there with my grandmother's body in front of me when I should have been grieving. And all I could think was, they're just spreading this virus around this home. My grandmother was the first person to die in Mavis Bank. And I just kept thinking, everybody else here is going to die if they don't stop doing what they're doing. And I kept on thinking, what do I do here? How do I stop this? There was no care or attention at all.
Right. I think you've mentioned that there were a number of deaths during this outbreak of COVID within your grandmother's care home.
Yes.
Were they all within that same period?
I believe so. There was 15 in total.
15 in total. Okay. And your grandmother was the first?
That's correct.
Just on the impact you talk about in paragraphs 83 and following, there's perhaps again two aspects to this. You say that there was no support from the home after your grand's death, and that they were almost borderline rude.
Yeah.
Can you explain how you formed that impression?
I think I called the home the next morning, as I recall, to ask what was happening about it, what they were going to do about it, and the manager was quite rude on the phone.
You say you called them to ask what they were going to do about it. What they were going to do about what?
About the outbreak, if there was anything that they would do. I think I asked how many staff members had been on the night before, because I was quite concerned about that as well. I'd only seen 3 staff, and I felt that wasn't enough. And I just didn't feel there was much in the way of warmth or condolences or care about what was happening.
And I think that set you off on a number of communications that you refer to in your statement, including calls to the Care Inspectorate.
That's correct.
What was your mindset about calling the Care Inspectorate? What were you thinking about doing that?
I just felt somebody had to do something to make sure that there was as little spread of this virus as possible within the care home. And I thought that the Care Inspectorate were the right people to contact to make sure that happened.
And I think you subsequently ascertained that there was a Care Inspectorate report, which had been done shortly before, on the 26th of October, and that's in paragraph 89 of your statement. We can read that. Yeah. And subsequently, you put in a complaint to the Care Inspectorate that you refer to in paragraph 91 with 4 grounds of complaint.
Yes.
Could you just read those 4 grounds of complaint to us, please?
Yes. So it was that the care home didn't give a satisfactory explanation about my grandmother's health deterioration and the actions taken prior to her passing away, that there weren't enough staff on the 4th of November to care for all of the residents, and that they did not maintain my grandmother's dignity by ensuring her clothes had been changed into appropriate nightwear, and that on the 4th of November the staff were observed by 3 family members not wearing PPE despite the care home having an outbreak of COVID-19. Yeah.
And as you say, the Care Inspectorate upheld 3 out of the 4 of your complaints.
That's correct.
Yeah, perhaps you could just clarify which one they didn't upheld, because it's probably easier to look at that rather than see the ones that they did.
They didn't agree with the fact that there weren't enough staff members on duty on the night of my grandmother's death.
No. Okay. The Care Inspectorate did a subsequent inspection on the 11th of November, I think.
That's correct.
You refer to at paragraph 93. What did you take from that, if anything?
Yeah, so the reason that the majority of my complaint was upheld was because they observed exactly what I observed with regard to the staff not adhering to PPE practices. Also, one of the staff members that I had seen on the night of my grandmother's death didn't have a uniform on, never mind PPE. He had a very dirty white T-shirt and jogging trousers on, and when they visited, he was wearing exactly the same thing. He was exactly as I had described him to be, and that's why they upheld that part of the complaint.
Need a break to do that? Yeah, we'll do that. We're close to the time when we need to give the stenographers a break in any event. So would 15 minutes be acceptable, Ms. McCall?
Yeah.
We'll take 15 minutes then.
Thank you, sorry.
Right. Mr. Gale, when you're ready.
Thank you, my lord. At paragraphs 102 and 103 of your statement, Ms. Grant, you make two fairly general comments. You say that it was such an unexpected thing for the whole world, but you expect to be by their bedside and holding their hand, and when you can't, it's horrible. I think we understand that.
Yeah.
You also say that you don't think that your grand's rights were fully considered. Can you explain why you say that?
Yes. I feel that she wasn't considered really through the whole of the virus. You know, I think generally elderly and vulnerable people, their health was considered, you know, they were protected from that point of view. Everybody was so worried about making sure they didn't get the virus, but their emotional and mental well-being wasn't considered in so many ways. In some ways, the isolation and the loneliness and the confusion and the fear was almost worse than the virus itself.
Did you come across, in the course of your grand's time in the care home, did you come across the concept of essential visitor?
No.
Okay. You did contemplate litigation against the care home, I think.
Yes,
but that didn't go anywhere, largely because of the fact that the potential of the cost, were you not to be successful, was prohibitive, effectively.
Yeah, we were advised to drop the legal action on the basis that the provider would take all the way and it would cost too much money.
Mm-hmm. The lessons to be learned that you set out in paragraph 108 and following, again, I don't wish to suggest that these are insignificant, but they are matters that we've heard from other witnesses. And if I can summarize them, one of those is your grand's isolation. The other was that you were watched over, effectively, with, as you see it, the suspicion that you might be somebody who could infect your gran.
Yes.
Yeah. You also refer to an undercurrent of, and you say sometimes, neglect and abuse in care homes.
Yes.
Now, that could be seen as a general comment, or it could be seen as a specific comment. What are you wanting to convey by that?
I do feel that it is a specific in this case, and a general comment that there are things that go that happen within care homes, whether it's neglect or in some cases some forms of abuse. And unfortunately, the pandemic meant that went severely unchecked, because all that was in the care home were staff members and the residents. There were no family just dropping in every now and again, meaning that things happened that wouldn't normally have happened. I think this means that, in my view, the entire care home system needs to be looked at. When we're talking about lessons to be learned, there needs to be the fact that I said to the care inspector that about 3 staff members looking after 26 residents who had dementia and all sorts of care needs, and they felt that was acceptable. I don't understand that. I think there needs to be some restrictions on staffing levels. There need to be more requirements with regards to training of staff members in care homes, and there needs to be some regulation on record keeping. All the records in the care home my grandma's in, certainly, and a lot of other ones that I've looked at, are all kept by handwritten notes. And in this day and age, there's hardly any institutions that are like that. Everything's digital, so I don't understand why care homes can't be the same.
No. And I think your particular concern is that you, in the case of your gran, weren't afforded the opportunity to go into the care home where you could have been a check on what might have been happening within the care home. Is that right?
That's correct. I think if this was anything like this was to ever happen again, then I don't see why relatives should ever be locked out of care homes. Yeah. If staff members can come and go to their own homes and supermarkets and other places, then why would it pose more of a risk for relatives to do exactly the same? Relatives, I think, would take much more care to protect their loved ones if they're coming in to visit them. So I don't understand why relatives were ever locked out of care homes.
Just one other matter. In paragraph 111 of your statement, you express the view that you didn't think, or you don't think, that there are enough ways to challenge guidance and instruction issued by the care home, because you just had to do what they said. Do you have any suggestion as to how you feel that those challenges could be made?
Yeah, I mean, there's a couple of things there. With regards to the care home, there is always this fear that if you go directly to the care home and complain about things and make yourself a troublemaking family, so to speak, that somehow that will have repercussions for your loved one within the care home. And I think a lot of people feel that way. So you don't want to cause too much trouble directly with the care home. You're not there to protect that vulnerable elderly person within the care home 24/7 or at all in the case of the pandemic. When you go to the care inspectorate, you make complaints and they'll go in, they'll do an inspection, they'll make recommendations, but particularly in my case, they make these recommendations, they tell the care home that they have to adhere to certain standards, they'll come back 2 weeks later and nothing's changed, and all they do is move the date forward another 2 weeks or another 4 weeks. And every now and again something will change slightly, but then within a few weeks again it's slipped back down to weak standards or good standards, or back down to weak standards. There's never any continuity, there's never any punishment or repercussions. And I think the care inspectorate system needs to be looked at completely. There needs to be an appeals procedure for a start that's not to the care inspectorate itself. It needs to go to somebody else. If you're going to appeal it, it shouldn't be to the same body. And there needs to be, recommendations that actually go somewhere. There needs to be, a punishment or fines or something if recommendations aren't adhered to.
Well, you've clearly given that considerable amount of thought, presumably over the time. Ms. Grant, thank you very much for the evidence you've given. It's been very helpful.
Thank you.
Yes, thank you, Ms. Grant. Thank you. Very good. Right, we do actually have to have a break for technical reasons, which again are beyond me, so I'll not try and explain them. So I think probably about 10 minutes, though, before the next witness. Thank you.